The views expressed on the following program do not necessarily reflect the views of Money Radio staff, management, or advertisers, and do not represent an offer to buy or sell any securities. Some interviews heard on this program may be sponsored by the participants. It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures Taking Stock in You. I'm your host, Bob Roth, and it must be Friday, and indeed it is. We're coming at you live from the Scottsdale Air Park Studios, Money Radio, 1510 AM, 105.3 FM, and the World Wide Web, moneyradio1510.com. If this is the first time you're tuning into our show is about how our older adult population can live a healthier, happier life. And how do we do that? We do that by bringing extraordinary guests to the show. And today's no different. We've been coming at you for over 8 years now. We've done at least 400 shows, and really, truly, our guests are what make it. And today I have a guest that is coming in through technology. Thank goodness for that. We've got Janet Dillione. She is with Connect America. She is their Chief Executive Officer, and I am really pleased to have her here with me on Health Futures today. Hello, Janet. How are you?
I'm great. How are you?
I am doing really well. I know that the corporate headquarters are over in Ballackinwood. Are you over there now, or are you working remotely from your home like many of us are?
I am enjoying a work-at-home Friday, so I am remote in glorious Westchester, Pennsylvania.
Fantastic. And how's the weather there?
Actually, today the weather is okay for the East Coast. It's really, really nice. It's 64 degrees and sunny. I mean, it's not Arizona.
No.
But for us, it's Superior, so it's great.
Yeah, we're here sunny, 75 degrees. We have a cool
I
day
know,
today, so
I
it's
know.
this is the time to live here in the Valley of the Sun. Well, listen, as I shared with our audience, our show is about our guests, and I'm really pleased to have you here on the show because you truly are a healthcare professional, and you've worked in healthcare for some time, and you are now at the helm of a company called Connect America. I'm going to ask a little bit more about you in the second segment, but
Sure.
I'd love for us to learn a little bit about what Connect America is.
Sure. Connect America, again, as Bob said, is based in Ballackinwood, Pennsylvania, which is essentially Philadelphia. But we are the largest independent personal emergency response and connected health provider in the country. So we have 373,000 subscribers that use our services. Our founder, Ken, is still with the company. We were founded in 1984 when we took our first call. But today, this month, we will do 250,000 responses to emergency signals. And to signals around medication management, remote patient monitoring, and we can get into that later. But again, we are a connected health company. We've been doing it for over 35 years. We have, again, 373,000 people who rely on us.
Wow.
And again, I'm happy to go into that in more detail.
Well, one of the things I would love for our listeners to really understand what we mean by these personal emergency response systems.
Mm-hmm.
So many of us are visual, right? And so many of us
Right.
remember the commercials, right? Help, I've fallen, I can't get up, right? That's the one that
Right.
many of us remember. But, PER systems, that's the acronym for Personal Emergency Response Systems, are, they do a lot more. And I would love for you to kind of unveil that and unpack that a little bit in terms of what that looks like.
Sure. Well, again, I think in terms of thinking about PERS, I think you need to think about there is the device, which could be in your home, but it also more than likely is with you. It's mobile. It goes with you. But the other part of the PERS that's important is the service. So there's no sense to have technology that generates a signal if there's nothing to respond to that signal or to that data. So it's not just having something that you could talk to or that sees you or watches you or monitors you in the home. You need to have that other end of the solution or the service or the call center. People trained, certified, they are 24/7, 365, that know how to respond to those calls. So that's a big part of it. That's the first thing is to understand. But you're right. The early PERS were about, help me, I can't get up. And today's PERS are far more sophisticated. Again, they are. There are voice-assisted PERS technology. We have technology that is monitoring activity. So someone wants to know how many steps, mom or brother or sister are taking. Are you noticing a difference in how active they are? We can do those kinds of things. We have digital technologies now that reach out to the care circle. So we have ways of letting family members or others know how their loved one is doing. We will communicate with them something as simple as we haven't heard from them. Do you want us to call? And you'd be amazed. I read the comments every week that we get in from the response center, and sometimes it'll be a son that says, "Thank you for calling, Mom. She won't answer this call from my brother and me." So we do a lot of reach out services to folks to make sure they're okay, and then we'll go ahead and communicate to the care circle to say, "Hey, we're in touch. Everything is fine." So it's technology that's evolved. It's gotten smaller. It's gotten lighter. It's gotten more visually attractive. But then the service side of it has also evolved and become much more, I'd say, health-oriented than just emergency-oriented.
Yeah, and what's interesting is that you talk about evolve, right? And so much has happened in healthcare and how we've evolved. And I know that your background is really in healthcare, but it's in healthcare technology and it's in healthcare predictive analytics, right? I mean, we want to try to negate a medical event, right? A medical event could be a heart attack, it could be a fall. I'm learning a lot about Connect America, but I mean, you mentioned monitoring. Are you monitoring, some activity that's happening? Are you monitoring movement? Are you?
We do. I apologize.
No, go ahead.
We do different types of monitoring. So you can think about the device itself as kind of a vigilance. So it kind of has with you as a set of eyes. So if something urgent happens, it's there. But we also have technology around remote patient monitoring. So we can take the blood pressure, glucose, weight. So we're monitoring patients who are at risk for chronic heart failure. We have hypertensive populations of patients that we're monitoring. For physician groups, we do glucose monitoring. And again, the idea here is it's great to capture that. Okay, what are you going to do with it?
Exactly.
Who's going to look at it? And the last thing you want to do is to bombard a practitioner or a physician's office with millions of data points. Right. There has to be something in there to intercede and to eliminate the noise and get the important information. Patient Janet is deteriorating. Something's changed, right? So some intervention has to happen. So we do that with remote patient monitoring. And then the other technology we have right now is what I would call medication adherence. So I don't know that anybody realizes, but about 70% of admissions for people over 70 are simply because they're not taking the medications as prescribed.
Well, I'll tell you I definitely want to hear more about medication adherence because that is a big, big thing. And, believe it or not, you hear the music, we're down our first segment. But I also, we talk about these PERS units and the data that we have, the numbers are staggering that only like 23% actually wear those pendants, right? But it's the other things that I think that you're going to tell us about Connect America that really makes you guys the preferred system that is out there. So get a little Marshall Tucker band. I told you we play great music here, taking us out in the first segment.
Very good.
You're listening to Health Futures, Taking Stock in You. I've got Janet Dillione. She is the CEO of Connect America here with me. We're down one segment. We got 3 more to go. Stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. Welcome back. You're listening to Health Futures, taking stock in you. I'm your host, Bob Roth, and if you're just tuning in, we're in segment number 2. I got Janet Dillione. She is the CEO of a company called Connect America. They're out of Ballackinwood, Pennsylvania. She's coming in via technology, via the phone line, as well as through my Google Meet on my computer. They are a remote patient monitoring company and a personal emergency response system, otherwise known as PERS. In our first segment, we talked a lot about PERS, and we talked about what Connect America is all about. We also talked about, as we were ending our first segment, we talked about medication adherence. And medication adherence is one of the reasons that so many people end up in the ERs and hospitals. So I would like to pick up where we left off in terms of talking about Connect America, and medication adherence.
Okay. Well, great. So right before the break, as I shared, 50% of patients don't take medications as prescribed. 70% of the admissions for people over 65 are directly related to the lack of taking medications as prescribed. So we actually have technology that prepackages the meds. You can do it for 7 days, 14 days, or 28 days. And as you extract the med, it sends us a signal. So we will know now. We have to trust that you're actually taking the med, but we know that you've taken the med from the dispenser, and we'll know that signal. So we're actually able to track that you have taken it. Conversely, we're able to have our care personnel call and say, Janet, we've noticed that you have not taken the blood pressure med in 3 days or 2 days. So it allows us to follow up with the service capability on the medication. So. But medication adherence is one of the most popular services we provide. Absolutely.
And one of the other things that cause people to go into ERs is falls. And
yeah.
I noticed on the website you've got a fall detection pendant. Can you tell us a little bit about that?
Sure. Yes. So I joined Connect America, as you said, pretty recently, which is in November. I'm, was somewhat familiar with the technology in the space, but as you do when you join companies, you begin to dig into the data. So I've begun a habit of every week I look at the log of calls that have come in, and basically every week it's about 59% of the calls that come in are related to falls. And people needing help. And again, we answer that phone in under 10 seconds. Our emergency response is guaranteed to happen under a certain amount of time at a certain, 99.99%. So all that is good. But to think about that staggering number of 59%, so what we've begun to introduce is activity monitoring, because there is science that shows that as difference in activity is an early indication of something, which could also be an early indicator of a fall. So we'll be able to. So we're going to be launching that at the end of the year. We'll begin to be able to keep. You don't want to sound Orwellian here in terms of watching, but you'll be able to see if folks are potentially trending in a bad direction and try to get ahead of that fall. So that's something that we're keen to get going. But as I mentioned, if I said 59% are about to fall, 41% aren't. I can tell you the second most frequent is, I'm short of breath. Can you help me? We're also able to dispatch things like Uber Eats or food delivery services for folks. There's no doubt that 1% of the calls are social isolation.
Right.
We absolutely get calls that have to deal with social isolation. As a leader in the organization, it makes me feel really good when I see comments come in from people and say, thank you for taking my call. We get, not unusual, we get comments from family members. Thanks. My mom told me my mom or my dad said that you called and spoke to us. So that's another important. Again, it's not just the technology. Connecting is caring. So we want to cover that part as well. But as I mentioned to you, we also get calls. Someone was discharged and they called and said they sent me home with the wrong no wheelchair. I can't get down my hall, so they can't get to the bathroom. So again, we dispatch services to help the patient get through that scenario as well.
Well, it's interesting, and I want to back up a little bit as you talked about falls, and I know that you're introducing these new fall detection measures, if you would, and I do want you to talk a little bit about your background, but it harkens back to your background in terms of technology, and really what I see, and I see companies doing it, and I'm so glad to see that Connect America is doing this as well, is that you are establishing patterns. And once you've established patterns and there are breaks in the pattern, that's where the computer or artificial intelligence will tell you, warning, Will Robinson, warning, there's something that is either happened or about to happen, and it gives you an opportunity to intercede.
Bob, I'd be happy to offer you a career choice at Connect America. No, that's exactly right. I mean, the benefit of having 373,000 people is that we know we have some information. So you're exactly right. So I actually brought in a friend of mine who happens to be a PhD in nursing informatics named Rosemary. And it's Rosemary, what do we see in this data? What can we do to help? What do we see?
Right.
So we've actually spent the last several months literally doing that, mining data, reading things, looking for correlations between the data, days of discharge and, types of things, anything we can do with the idea of how could we intervene. Because what we also know is that if someone does fall, that 90% of the people who get help within an hour are fine. They go back home. So that's incredible, right?
Yeah.
So if you can get ahead of this curve, you really can be helpful and do some things. But you are absolutely on. We are looking for patterns. We're looking for correlation. Again, outside of Connect America, and you do want to use real world evidence, right? You want to use facts and science. There is titled, third party reviewed data that says track the activity, and it'll be a leading indicator. So again, we're focused on getting that technology out there.
I would love to leave in the second segment here a little bit about you and your background. I know you probably don't want to talk a little bit about yourself, but you are perfectly suited for this position that you've taken on because you are a healthcare professional. And if you could share with our listeners in just a minute or two about your background and how you got into healthcare as well, because you and I talked before and you asked me about me getting into the business. I would love to hear about how you got into it.
Okay, great. Looking forward to it. Thank you.
No, we have some time right now. Please.
Want to do it now?
Oh yeah, let's bring it on.
My apologies.
No worries.
Sure. I think many of us are like this. We're headed down a path, and then as I said, get distracted or diverted. I was a classic pre-med kid. I did the whole thing. I did MCAS. As I look back now, I was like, oh my God, why did I take all those chemistry classes? But I was waiting to go to school, and I was offered a summer job, and they were doing a thing called a computer conversion, and I got involved with it, and I never turned back. I just fell in love with the technology and what it could do, and as I said, I could not do computers in another field because I've been about healthcare. So for me, the passion has been, how do I take technology and improve healthcare through that angle? I'm not going to cure cancer. I wish I could. I'm not. But can I leave what I find a little bit better because I've been able to figure out how to make technology help make it better? So that's kind of been what my passion has been.
And how did you come to Connect America?
Through a very tortured path, demonstrating some obvious angles of OCD in myself. Seriously, I was fortunate. I started my career with a company called Shared Medical Systems, which was in Malvern, Pennsylvania, which at that time was the largest EMR. We were acquired by a global company, Siemens. Siemens was a huge company that was worked around the world. So again, doing healthcare IT, I got an opportunity to see healthcare delivered in Singapore and in China and in Germany and Sweden, and it's amazing. It's amazing because it always is about the person at the end. But it was interesting to go see all those different places, and And then had an opportunity. I became the CEO of Siemens Healthcare Services Unit and did that for a few years, and then had an opportunity. And I said I wanted to stretch the strategy muscle. I wanted to get a little edgier. And there was a company called Nuance, which was just acquired by Microsoft. But Nuance, we were the bleeding edge of real-time speech, machine learning, AI. And I thought, what a great way to attack the toxic problem in healthcare, which has to do with documentation. So, and you've read all about burnout for physicians and nurses and using EMRs. It's just a horrific problem. And behind that horrific problem are the complex reimbursement regulations. But I thought, wow, speech, if we could do that. So I worked on that for a few years, had the opportunity through that to do some early work with machine learning and AI, and got some real great learnings that have stuck with me. And then I had the opportunity. So I had been in public companies. I was fortunate. I had big jobs in public companies. And then I had an opportunity to go run a small startup private company and said, hey, that sounds like it would be interesting. And it was very clinical. It was FDA regulated. It was a company that had been founded by a Yale anesthesiologist. And as I like to say, they had a hunk of great technology. And then the job was to find out how to get that technology to solve the tough problem in healthcare. And we figured it out, and it had to do with real-time surveillance. So we were able to see patients that were deteriorating.
And a great segue into Connect America. We'll learn a little bit more in the second half. You've been listening to Health Futures. I've got Janet Dillione. She's the CEO of Connect America. We're at halftime here. Stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. I'm your host, Bob Roth, and we are in our second half. If you're just joining me, I've got Janet Dillione. She is the CEO of Connect America. They're a remote patient monitoring company, also a personal emergency response systems company as well, otherwise known as PERS. If you missed the first half, you can catch it right up on our website at cypresshomecare.com. Click on the media button, third button down is radio show. You'll catch the first half of this show and about 400 others that we've been bringing to you for the last 8 years. So when we wrapped up our second segment, Janet was telling us a little bit about her background, and really it's incredible, her background. She wanted to be a doctor and chose not to be a doctor and chose the healthcare vertical. She got involved in technology and worked for an incredible company, Siemens, that us old-timers, we all know who they are. And her career has evolved. She was involved in a startup, and she has now landed since, I think she said October of 2020, as the CEO of Connect America. So we've talked about a lot of different things. I want to jump into this remote patient monitoring and telehealth. And there hasn't been, no one could have predicted this pandemic, although a lot of people said we knew something was coming. We just never predicted that it was going to cripple us the way it did. And telehealth and remote patient monitoring has really been at the forefront for physicians and medical professionals to be able to stay connected to their patients. And I would love for you to talk a little bit about what you probably have seen in terms of an uptick in that area.
Absolutely. I mean, it's we call it a tsunami. There's no metric that would measure remote patient monitoring that's not showing crazy growth. And I think that what we've seen with remote patient monitoring COVID supports something that a lot of us who've been in this area for our careers remember, which is that it's highly unusual that technology changes healthcare. What happens is the process of care delivery changes. And then the technology is either already there or is there just in time to support it. And what happened here was the classic, event called COVID. And that absolutely forced the change of remote care delivery. Remote care delivery technology has been in the market for 20 years. But it was COVID, and that change that compelled the process that allowed the adoption of the technology.
And the adoption was like in the 20%, and post-COVID or because of COVID, we were up like 70%. So many doctors were now involved using technology, and we can thank Congress for lightening up or releasing the stringent HIPAA compliant platforms that were needed.
Mm-hmm.
So a lot of doctors were using devices to FaceTime, using people like Skype and other resources to connect with their patients. So I think it's really cool that happened, and things in healthcare usually happen, and you being a healthcare professional, they usually happen at snail pace, and all of a sudden,
yes, we have adopted the phrase glacial. Yeah, things happen glacially.
And this was a hockey stick. I mean, this just really jumped really high up.
It's a hockey stick. The data right now shows that it is sticking. It's down a little bit, but it is sticking. And the other thing that, again, we can all get jaded and cynical and whatever we want, but the reality is that, there is a little bit now structure behind the change because there is reimbursement. In healthcare, there's a phrase, there's a CPT-4 code, which means it's a reimbursable procedure, and that Congress has made that. Congress has made that change, and that is supporting the continued use of virtual health, remote care delivery.
And for people like myself who have been in this space now my family's been in it for 27 years, and when you are caring for an older adult, to get a 90-year-old, a 100-year-old ready for the day to go get in that car and drive to the doctor's office, to sit in the exam room, or waiting room first, and then sitting in an exam room, that is exhausting, and that is a huge process. And a lot of times, we have older adults that are on really powerful medications. So the doctors want to visit with them just to, one, they get a panel done so that, whether they do blood or urine, just to see where they're at and making sure that the medications themselves are not having a detrimental effect to their organs and other things in their body. But at the same time, they want to see them. And, I think utilizing technology and telehealth gives them that opportunity to see them, but it doesn't come along with the exhaustion that it comes with in terms of getting someone there. And then on top of which, we could be exposing these vulnerable adults to other illnesses and diseases that could be present in the waiting rooms and the exam rooms.
Absolutely. And I think the adoption of telehealth, again, it's past. It's now going to be very, very common as a delivery for a certain subset of patients. I think the market itself is still experimenting, which is the right end user technology. And it's going to be different, right? It's going to be different for the 40-year-old mom who may have 2 kids that need a quick check versus maybe somebody who's a little bit more at risk in their 70s or something else. But the market's going to jiggle a little bit, I think, for a while and figure those things out, but the market will figure it out. So, but it is, I think we're done. It's here. It's not going away.
So when you're doing remote patient monitoring, you're obviously utilizing devices that may be in the home. And is that something you guys supply? I mean, if people, first of all, I want to give you a shameless plug. So if people wanted to learn more about Connect America, it's real simple. Go to connectamerica.com. And if you want to email, then email contact us at connectamerica.com. But the equipment and all that stuff is stuff that Connect America does provide?
We do. And actually, one of the problems with adoption of remote patient monitoring was how hard it was to get the technology into the home. Because the physician's office are not technologists, hospitals don't deliver technology. So for a company like ours that has somehow figured out a way to get technology into the home 373,000 times,
exactly,
it was a very logical extension for us. So actually, payers come to companies like Connect America and say, "Can you help us?" Because it's a hard thing to do, to package, to ship, to design, to fulfill, to get it into the home, and to activate it. So we are that's a proficiency that we're happy to see deployed to take care of remote patient monitoring.
Fascinating, and you too probably have seen an uptick in this in the last 6 months to a year, I would imagine.
Absolutely. We had, what we have seen is, I don't know whether folks realize it, but some of the post-COVID world is, for some of that unmet need that got exposed, like the at-risk population, the government has tried to support that with some funding. So there now is grant money out there called, federally qualified grants, trying to help get remote technology into the less wealthy population, right? The folks in the cities or, quite frankly, rural areas. And they are supporting that with grants. Those grants were just posted. And that is, again, going to accelerate the adoption of remote patient monitoring.
It's interesting because, we often talk about the social determinants of health. And that's what you're certainly talking about, those that don't have the fortune of having bandwidth, having access to, the resources to be able to do these types of things, to be able to keep their health going really well. The other thing that we learned through this pandemic is that there's a huge digital divide. Our older adult population hasn't really quite grasped technology. I mean, just signing up for vaccinations was hard enough for me. I just can't imagine what it was like for an 80 or 90-year-old. Well, you hear a little bit of The Who. Baba O'Reilly is going to be playing us out here in our third segment. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. I got Janet Dillione. She is the CEO of Connect America. Stick around. We're going to talk about the future of care when we come back in the fourth segment. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress HomeCare Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and we are in our final segment. I've got Janet Dillione. She is the CEO of Connect America. If you missed our first three segments, you can catch them right up on our website at cypresshomecare.com. Click on the media button, third button down is radio show. So we've talked a lot about this incredible company that's been around 1984, is that the year? How many years?
That's correct.
1984. Correct. Wow. I don't want to date myself.
I disavow all knowledge of the company at that time because I was obviously in utero.
Well, you were in utero. I was in college. I was just graduating college at that time. So, it was a long. It was a long time ago, but they are one of the more mature companies that have been out there for a long time, making a difference in the lives of the people that they do serve. And speaking of people they serve, they got 373,000 clients across the country. Just fascinating. So we've learned a lot, and we've talked about, most recently in the third segment, we talked about the pandemic and how it's really opened up, the healthcare vertical to really adopting technology, which, Janet shared with us. Healthcare and technology have kind of been at loggerheads over the years, and it's really taken a long time for them to adopt certain things. And it's amazing. Sometimes we feel like we're in the medieval times. I mean, there's nothing more annoying than when you're going to a specialist or a new physician and you got to fill out all that paperwork. And it's just like, okay, come on. It's got to be easier than that. Can't I just get the document beforehand and just auto-populate it? Because all that information's in my computer. So they are starting to move. But there's other things that are about to move too. And, Janet, I'd love having you here on the show. You're a healthcare professional and would love to, get your take on what you see the future of healthcare going forward. I know you're newly at the helm. You've been at the helm for, 6, 7, 8 months now. But, what do you, if you had a crystal ball, what do you see happening in healthcare in the future?
Well, I'm going to focus my comments on what I would call we're in, which is the pre-hospital space. So, I think that some of the trends we'll see in pre-hospital would be the same across the continuum, but let's focus on this. Clearly, the healthcare at the home, some people are now calling it the hospital at home, is here to stay. The consumer has spoken. The consumer wants to age gracefully, independently, and safely at home.
Mm-hmm.
So the technology will evolve. So I think for us, it means that the technology will continue to get smaller, easier to use, have more, capabilities to it. And I think the services will evolve as well. And you asked before, do we call our customers? We do. And we're going to be absolutely expanding what I call those care companion services. Because remember, part of our charter is to keep people healthy and safe. And sometimes, as much as I love technology and I've spent my life with it, sometimes you just need that human touch.
You do. And I'm a big supporter of that. I mean, obviously, I run a home care agency, and there's nothing that's going to replace humans. But, Janet, I know you follow this. We have some challenges that are ahead of us. The biggest challenge we have is workforce right now. And we had this problem long before the pandemic showed up. And the reason why we have this problem is we are aging at such a rapid rate. I mean, when you talk about just here in Arizona, in the next 8.5 years, by 2030, we're going to have more people 65 and older than we are going to have 18 and younger here.
Wow.
There's a group out of New York called the Paraprofessional Healthcare Institute, and they are saying that we will have between now and 2026 about a 1.8 million person shortfall in direct care workers. And that was also before the pandemic. So we are aging at such a rapid rate that we have to adopt technology and couple that with humans, with people, because people do the care. And, one of the things that you mentioned when we first started talking is the fact that you have people that are calling in to check in on, you got adult children saying, hey, I can't get a hold of mom or dad. Can you call in? I mean, because because the call box that is there, if I remember correctly, it's a speaker, and we can
use it as a speaker.
And you can contact that person that way. But the other part is, and I learned this at the break, you guys can do outbound call to just do check-ins too. And
yes.
When we were getting ready to break, we were talking about the social determinants of health, and we talked about the economics to that. We also know that the demographics to it are really big as well. And when I talk about demographics, I'm talking about loneliness. Social isolation has been a huge issue for us prior to the pandemic, and now it's even worse. So I would imagine that, you can and do outbound phone calls to do check-ins.
We do outbound phone calls. We do schedules. When we don't hear something, right? If we don't get a ping from our customer, we do reach out just to check in. We do that. The other thing we're doing is we're actually developing, because we have a digital platform, and we're actually developing an app, some kind of a more digital experience, and we just put it in front of 10 called them target customers last Wednesday night. We literally had a user group of folks between the ages of 70 and 85. We had one couple on, a husband and wife. It was great. Well, we put this app in front of them and said, give us feedback. And it was really fascinating, because what it came down to is they really wanted us to personalize technology around their care circle.
I love it.
Which is their the grandchildren came up number one. Do not, and they literally said, do not put something out there, because I don't want all my kids calling me. So, but that's where they wanted the intimacy. They knew that there were apps in the universe. They knew that all that tech was out there, but personalized for me, my care circle. Can you do that with that technology? Yes, we can.
I absolutely love that. And it's so important for us to really understand that technology is only as good as it is being used. I was part of a group, and you may know the group. It's called Aging 2.0, and it was basically basically an incubator or a curator of technology and innovation into the senior world. And one of their people, she was a retired physician, family doc. She's like 94 years old, and she always makes a point in telling the startup companies there, I am the CEO of Aging 2.0, and that means I'm not the chief executive officer. I'm the chief experience officer, and every single one of you needs me on their board, advisory board, not just me, but someone like me. And I love the fact that you guys are utilizing your clients, because we can sit here in these ivory towers and come up with these great ideas, but they're the ones that are going to be adopting them.
Well, I want to put the offer out there. You gave that Connect us at connectamerica.com. We'd love to hear from any of your listeners. If you would be interested in helping us test things, we would love you to reach out. We would love to have you. We're doing our second round of testing actually next week with a group up in the Northwest.
Fantastic. Well, listen, we have about 30 seconds. Is there any last things that you want to leave, lasting things you want to leave? Any questions I haven't asked of you with our audience?
It's been a great experience. I appreciate the opportunity. And again, I think a lot of us are motivated to try to leave things better than we found them. And that's what we at Connect America are trying to do with taking care of people who want to age independently and safely at home.
And that is what Janet Dillione is doing with Connect America. Thank you for joining me on Health Futures. Thank you, listeners, for joining me as well. We come at you live every Friday from 12 to 1. We'll be back next week. Make it a great day. Have a great weekend. Thank you.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.